Tonight's bedtime lesson is about an MRI scan. Now, magnetic resonance imaging, also known as MRI, is a type of scan that uses strong magnetic fields and radio waves to produce detailed images of the inside of the body. An MRI scanner is a large tube that contains powerful magnets. You'll lie inside the tube during a scan. An MRI can be used to examine any part of the body. The results of an MRI scan can be used to help diagnose conditions, plan treatments, and assess how effective previous treatment has been. Before an MRI scan. On the day of your MRI scan, you should be able to eat, drink, and take any medication as usual, unless you're advised otherwise. In some cases, you may be asked not to eat or drink anything for up to 4 hours before the scan. Other patients may be asked to drink quite a large amount of water beforehand. This depends on the area being scanned. When you arrive for your scan, you'll be asked to fill in and sign a questionnaire about your health and medical history. This helps to ensure that it's safe for you to have the scan. When you arrive for your scan, as the MRI scanner uses strong magnetic fields, it's important to remove any metal objects from your body. These include, there's a lot of them, watches, jewelry such as earrings and necklaces, piercings like ear, nipple and nose rings, dentures like false teeth, hearing aids, wigs, hairpins, medicine patches, glucose monitors, and tethered or patched insulin pumps. You should avoid bringing valuables along with you to your MRI scan. However, any valuables you do bring can usually be stored in a secure locker. Depending on which part of your body is being scanned, you may need to wear a hospital gown during the procedure. If you don't need to wear a gown, you should wear clothes without metal zips, fasteners, buttons, underwire, bras, belts, or buckles. Is it safe? Is an MRI scan safe? An MRI scan is, thankfully, a painless and safe procedure. Extensive research has been carried out into whether magnetic fields and radio waves used during MRI scan may pose a risk to the human body. No evidence has been found to suggest there's a risk, which means MRI scans are one of the safest medical procedures available. Some patients occasionally experience a tingling sensation or feel hot for being in the MRI scanner. These effects only last for a short while and should ease as soon as the scan is over. You're given a squeeze alarm which can alert the radiographers if you have any concerns during your scan. MRI scans may not be recommended for patients with certain implants or foreign bodies. If you have any metal in your body, you should tell the person referring you for the scan. This can be then looked into before your scan. Contrast agents. Some MRI scans involve having an injection of a contrast agent. This makes certain tissues and blood vessels show up more clearly and in greater detail. Sometimes the contrast agent can cause side effects like feeling or being sick, a skin rash, a headache, and dizziness. These side effects are usually mild and don't last very long. It's also possible for contrast agents to cause tissue and organ damage in people with severe kidney disease. You may be given a blood test to determine how well your kidneys are functioning and whether it's safe to go ahead with the scan. You should let the staff know if you have a history of allergic reactions or any blood clotting problems before having the injection. Anesthesia and sedatives is our final one. There'll be 3 parts to this one, so this is part 1 out of 3. I'll just say 1 out of 3 bedtime lesson, MRI scan, part 1. An MRI scan is a painless procedure, so anesthesia, pain-killing medication isn't usually needed. If you're claustrophobic, you can ask for a mild sedative to help you relax. You should ask your GP or consultant well before having the scan. If you decide to have sedative during the scan, you'll need to arrange for a friend or family member to drive you home afterwards, as you won't be able to drive for 24 hours. babies and young children may be given a general anaesthetic before having an MRI scan. This is because it's very important to stay still during the scan, which babies and young children are often unable to do when they're awake. Time for our final bedtime bird.